Hi, everyone. Welcome back to another episode of Driscoll Decoded. My name is Angela, your host for this podcast. So today is a spooky episode. What perfect time to talk about it because we're in October, Halloween, festive month. Whether it's Halloween or just eating candy, an excuse to munch out, really. So today we're going to be talking about dental health. I think it's a perfect opportunity to dig deep into our teeth and start like unveiling everything that we need to know about our dental health because does everyone really know dental health is like the core of our overall health and it really has a lot of impact on it. So to welcome into the pod is Dr. Carmen Martinez. She is the Associate Dental Director here at the Health Plan. So welcome, Tooth Fairy. Love it.
Costume together.
Yes, very fitting, I would say. I was
I love it.
courtesy of my daughter's
I love it.
Halloween stuff.
Perfect.
Thanks. So welcome. I'm so glad you're here. This is a perfect month to dig into how important dental health is. This every month really is, honestly.
No, I'm glad that you guys are putting a lot of emphasis on this. I think, we take it for granted sometimes that Halloween is like a free for all. Like we can just go crazy, eat that whole bag of candy, do all this, which, we all are guilty of, I'm sure, when you were a kid.
Mm-hmm.
Yeah.
Mm-hmm.
Or did your mom ever make you have to share them with your siblings? If you got more than the others? I don't know. We had to do that.
No, and I think that's probably the worst part of it.
It was all to yourself?
Shared, yes. And so it lasted like probably until next October.
Oh. Did you keep it in your room?
Yes.
That was like your little personal stash?
And if it wasn't like candy, it was like caramel apples or like just like healthy stuff, but like with like it was just treats. Like, we're not gonna eat like this the whole year.
Yeah.
Little do you know, you end up kind of eating like that the whole year.
At least for weeks.
Yes.
At least for a couple of weeks, we're just going crazy
Agreed.
on the sugar. So I think this is a great way to just put a little emphasis, like you said, just a little awareness that let's just think more a little, about our teeth. And so we can still enjoy the fun stuff.
Of course.
Not get sick over it.
All right. So associate dental director here at the Health Plan. Give me some insight of just like what you do on an everyday basis.
I know it seems kind of strange to have a dentist in a medical health plan, but I think it's really great how Driscoll has paid attention to the fact that our dental health really affects our overall health.
Mm-hmm.
So to have a healthy mouth, you're going to have a healthy body, especially if you already have chronic conditions or if you're already sick with other things. If you have a sick mouth, it's just going to make everything worse.
Oh, wow.
So we really want to make sure that these two things are thought of together. Normally we think, well, you go to your doctor and then you go to your dentist. For this. We don't think that it all works together, but our teeth are connected to the rest of our body. So these are important things to think about. We really want to emphasize that, you don't want to wait till it's too late.
Exactly.
You don't want to wait for pain. You want to do it. So here at the health plan, they brought me on so I can go ahead and kind of share the dental wisdom, kind of show how oral health is incorporated into overall health. So we do it internally and we do it externally. Okay. So inside we talk to like the call center. We've given them little tidbits on how to answer calls when they get them, when people call for dental questions.
Oh.
So sometimes they'll call and they'll say, hey, I'm trying to get an appointment with my dentist. I don't know where to go. And a lot of times before it'd be like, well, contact them. Now we're finding ways of how we can help guide them to their dentist. So that's helpful. A lot of the member outreach, there's always been dental health or oral health in that, but now we're just stepping up a little higher to really show that we're here. We really want this to be important to the members and their families. Also to the PCPs, the pediatricians out there and the nurse practitioners and the physician assistants. We're telling them, let's please look at teeth a little bit more. Let's pay a little bit more attention to these things. Let's try to help kind of bridge that gap in care and get them to their dentist so they can have overall health. So my mission is to just touch every corner that the health plan touches and just put a little dental spin on it, make it more aware. So that we do have, like our vision was so every kid is well. Yeah. Well, your teeth are part of that. So that's what we're here for.
Yes. And you know what? Like growing up, I just remember kind of like the talk of like, well, dental insurance is like an extra thing, so it's kind of like a luxury.
Yeah.
And if anything, that's how I kind of grew up and not really knowing the importance of how this is like like I said earlier, the root of everything.
I like that. I see what you did there. I like
that. So yeah, so the fact that we're not only like combining the importance of, you know, these two are connected. Yeah. It's not a luxury thing. It's just as important as having a PCP for your regular health. So yes, I'm so glad that you're here today and we could go into that.
Well, and if I could just say on that, I think that's a fantastic point. Normally you go to your doctor all the time. You have to get your vaccines for school. You have to do all these other things. You go because, cough, cold, congestion, you go see your doc. But you always just think, I'll see the dentist when something hurts. Or their baby teeth, they're going to fall out. Who cares? So I think there's always been kind of a lax attitude. Sometimes, not for everybody, but for some. So I think with all this education that we're putting out there, all this exposure to dental health, I think it's really going to encourage people to maybe not be afraid, maybe not think that these are two separate things, medical and dental, and just start thinking of it as a comprehensive or overall health plan for themselves.
Yes, so. I love that because it was definitely, times are changing. And so everything's basically coming to light about like the importance of everything. And so I think it's just from older generations of that luxury kind of thinking.
For sure. Or I know like I'll say our parents or grandparents, they come from a different generation where you think, well, I'm just going to get old. My teeth are going to fall out and I'll have dentures. Like you just assume you're going to have dentures. Like no one thinks you can kind of keep your teeth till your end of days. Like you really can if you take care of them. Yeah. They should last you to the end.
Yes. Yes.
So wow. I think we need to change our, and a lot of that comes from just education. Just we didn't know. But today with, the internet and social media, there's so much information out there, which is very helpful. So it does kind of spread that message out there. And as for insurance, you're right. It kind of is still somewhat of a luxury because it is pricey. This is why prevention is so important. That's why we got to make sure we take care of it so we don't have to get the more expensive things.
I like that. Yes. So tell me about so you're here at the health plan and you're making waves. Tell me about the times that you're practicing, like in the dental office.
So I've been a dentist for 20 years.
Okay.
I'm from Corpus, so I started out here at school in 5th grade. I'm like, I want to be a dentist.
Yeah.
And I loved my hygienist. Loved her. Belinda, I loved her. She's still here in town working, and she was my inspiration. I would always say, I want to be a dentist like Belinda.
Aww.
And you get older and you get into it, and so I went to dental school. I chose while I was in school, I chose to do like a loan repayment program when I graduated. So I went down to the Valley, started working in public health clinics, and it was a beautiful experience. I loved it. I got to see a lot. I learned a lot. I was able to do a lot of things I wasn't able to do in school because they needed it.
Yeah.
So it was an amazing experience. Since then, I've worked in multiple public health clinics. I've worked in private practice. I've owned a practice. I've sold a practice.
Nice.
I've been around.
Yeah. So, you've seen every corner of everything. Yeah.
So it's been good because you get full exposure. I mean, from babies to the oldest. My oldest patient was 96 years old. Wow. Still driving. He drove himself to his appointment. Still had the majority of his teeth. It was amazing.
Yes.
He was like, you want to talk about good health? Yeah. That man, he's probably still alive now. And that was 15 years ago, maybe. So, yeah.
That's awesome. Wow. So it really set you up for where you are right now because you've seen every corner of, the dental world and every path that leads to it. So while you're here and implementing new strategies, you know exactly what you're talking about.
Well, I hope so. Of course. I hope so. But what I have kind of gathered from that is that this, telling kids to brush your teeth or taking care of your teeth, it's not a single person event. You need family involvement. You need mom, dad, caregiver, aunt, uncle, grandma, grandpa, whoever's in the house. You need them to encourage it also. It's like anything else when you need to make a change in life. Everybody has to do it. It just makes it easier. So if I could push one thing, this isn't just, hey guys, tell your kids to brush their teeth. It's like you too.
Exactly.
Let's do it all together because it's only going to help everybody.
Yeah. It's like potty training times 100.
You kind of have to
it never ends.
Show, tell, do, right?
Yes,
so it's you kind of have to be that good.
Oh my goodness. Yes. I really do like that because one thing I wanted to do differently becoming a parent was to make sure dental health was a a priority.
That's awesome.
And when they say like, oh yeah, what is it, 6 months? Like whenever the baby has her first tooth or 6 months of age. And so I started taking her at that age, and she loves the dentist.
Oh, that's
Like
so
she
good.
surprised me with whenever she was like maybe 2, like already just in the chair by herself, just already just doing everything and not crying or anything. I'm like, that's my girl. Like just like having them so used to the environment and used to like someone just checking on their teeth. I love that.
And the smells and the noises and all those things that can be intimidating. It's like when you take your kid to preschool for the first day. They're scared. They don't know what to expect. You know, they're looking around. They hear other kids. Like everything. It can be stressful. Going to the dentist, same thing. You get them in young, they're just used to it. Like they'll hear noises. They'll smell the crazy smells of fluoride or whatever else is around, and nothing is going to be scary to them because they're so used to it. Exactly. And again, you go to the dentist twice a year, sometimes 3 or 4, depending on how much they need you there. Or what your conditions are. And then what do you do for the rest of the year, right? So you need someone to help you clean your teeth at home and get them used to that and touching their mouth and touching their teeth. So when they do go, it's like, okay, I've been doing this.
It's so funny because like my girl, she loves the dentist and she lets him just do everything. But with me, it's like, no. I'm like, what's the difference?
Because you're mom, right? Moms, what do moms know? What moms don't know. My daughter, for example, I'd taken her for her orthodontic appointment a while back, and the assistant who was working on her tells her, I think you really need to floss a little bit more. She's like, Mom, I need to floss. I'm like, really? Really? Like, I've been telling you for years. I mean, I'm not just mom, but I know a little something about this. No, he said I need to floss. I'm going to floss. I'm like, okay. So he was a superhero. He was like the one who was able to get her to floss. Like, all right.
Okay, so it's like a universal
It's thing. It's your mom. Like, what does mom know? Just drive me here and pay for everything. Right. Like, what do you know?
That's so funny. Oh my goodness. So I know there's like a lot of misconceptions about dental health as we kind of like introduced already. What are some that you hear like when patients come in for the first time into the office?
I would say the biggest misconception for dental care is it's going to hurt. It's always going to hurt. So there's always going to be pain somewhere, somehow, some way. Whether, they got to get pain in their mouth or pain in their pocketbook because they got to pay for something expensive. So there's pain. And I think that dread and that anxiety of going sometimes keeps them out longer than they should. So I don't want people to think that every time you go, you're going to be poked and prodded. Something's going to be yanked out. Something's going to be drilled on. You're going to get a shot, those type of things. Like it doesn't always have to be that way. Go in and, do what you need to do. Get your cleaning, get your exam done. And also know what I want people to know or really think about is you have to be your own advocate always. Whether I'm your dentist, whether anybody's your dentist, or even your physician, anybody in healthcare, if they tell you need A, B, and C, think about it, research it, ask questions. Don't just, okay, well, that's what I have to do because that's what they told me. Ask questions, because if you're educated on it, it's not as scary, and you pace yourself. If they tell you have 15 cavities, you don't have to fill them all right then and there if you don't want to. So don't feel pressured. Don't feel like you have to do everything there. If they tell you need it, you need it. But, just baby steps. Like, don't get so overwhelmed by it. Like this is something that you don't need to do away. Yes, cavities are important to fix. Yes, you don't want them to get worse. You don't want them. But at the end of the day, worst case scenario, you lose a tooth. You're not losing a toe, a kidney, a heart, a liver, lung.
Very true.
It's a tooth. It's important. But teeth can always be replaced. But nothing beats a natural tooth. So try to save as many as you can, people.
Honestly, that's a great tip. That's a great tip right there because like especially when you don't go often and you have like one bad experience, it can be traumatizing and just kind of stop someone from going to see the dentist.
Absolutely.
What are some signs, whether it's for children? Well, okay, let's talk about children first. What are some signs that they need to go see a dentist?
Well, again, like you had said, you started taking your daughter at 6 months. It's always good to take them the earlier the better so they get used to everything. So as they go, they're evaluated and you see, so they can kind of catch. So if they start seeing little brown spots, little white spots on teeth before they break into these huge black spots, they're able to catch it early. So sometimes when you have little white spots, they're able to put a little fluoride to help reverse it. It's a tiny little cavity. Sometimes they'll watch it or they can just scoop it out, put a little tiny filling. Once it gets to a certain point, that's when we start talking about, little silver teeth and little phlebotomies and stuff like that. So when you start seeing your child maybe just eat on one side of their mouth,
okay,
maybe avoid some of their favorite foods or favorite treats because you know they like them. They're going to eat them, but when they're not eating, like, why? Do you have pain in your mouth? You're swollen. Sometimes the smaller ones will cry. Other than like teething, because that can be uncomfortable. You know, when you start noticing little swellings in the mouth, and that's why it's important for parents to look in their kids' mouth.
okay.
Like we don't. Like we'll look at their elbow if they get a boo boo or their knee, but we don't think to just look in their mouth. Look in your kid's mouth. You know, take a look and see what is in there, and then you'll be able to see little discolorations, or again, their behavior will tell you when they need to see a dentist.
Okay, and then what about for adults?
For adults, again, you're a kid who was traumatized by a dentist, you're probably not going to go until you're 35, 40, or until something hurts. And again, it's the wait until something hurts, which I respect that. I do the same thing. I know I'm a dentist, but I do the same thing. I'm like, it's sensitive. I'll just hold out.
Yeah,
hold out. It's fine. And I'll eat on the other side till this stops. And we all do it. But yeah, if something's hurting you, go get it looked at. I know the anxiety of what it could be, but at the end of the day, it's a tooth. It's not going to be anything serious. You know, we can live without teeth. We don't want to, we shouldn't, but don't let that fear get you because, and find yourself a dentist that you feel comfortable with. You may have to go through them. It's like dating sometimes. Like you may have to go through people to find what you need, right? It's not always the first one that you find. So if you're not comfortable, if you feel like they're not listening to your questions, you feel like they're kind of rough with your kids. Not rough. I should. I'm not saying rough out there. I just, sometimes like, you're on a schedule. You have to see everyone there. So sometimes some children need a little bit more time. Some adults need more time. I will say that some adults sometimes are more scared than children.
Okay.
So
that makes sense. So
find yourself a comfortable place and go and get what you need done.
Just a little plug for our viewers there. If you have Driscoll Health Plan as your health insurance, call our member services line at 1-877-324-7543. And if you're looking for a dentist or a PCP, call that number and we can get you set up. There'll be someone on the other side of the line to help you with that. But also, if you have any other insurance and you're seeing this, check on the back of your card, call that number, and you should be connected with someone to help you figure out who's in your network and who you can actually go to. It's October, like we said, and Halloween is at the end of the month, but school, festivals, we can never get enough of this festive month where it's just treats, candies, everything sugary that we want. And like initially going in, you're like, oh, okay, it's just 1 month. We don't do this next month but it's the holidays too. So you're like, oh, of course you're going to indulge in all the sweet goodness.
Absolutely. And especially because at least my daughter is an October baby. So you also have birthday party candy.
Yep.
You got birthday cake. You got your ice cream. Then you got your Halloween. And then before you know it, it's Thanksgiving.
Yes.
And then you got pie. And then you got Christmas. And then you turn around, it's Valentine's and Easter. It's like it never ends.
Yeah.
So,
No, October is definitely the kickoff for that. Okay. So I know as a parent, whenever their children are doing trick-or-treating, like there's many things on our mind. And so that can be from candy safety of what's being put into their trick-or-treat bag. But most importantly, especially for this episode, is also what kind of candy they're going to be indulging in and what we're going to allow. So what types of candy, and I wish I brought some candy.
That would have been fantastic.
Yes. So
for research only, right? Only for research.
Of
yes.
course.
Okay. I mean,
nothing off camera.
Nothing care about this job. I would eat candy for you. Okay.
So what candy are the most damaging to our health?
Well, okay, so it's a layered question in the sense that, I mean, we give candy a bad name, right? But we also got to think about fruit chews and, certain fruits that are like dipped in sugar given to the kids. So there's so many different ways we find our sugar, right? So sugar is tasty and it's good and it's delicious and it's fun, but it does cause damage if we don't get rid of it in a timely fashion.
Okay.
So if we're going to talk about candy, any sticky, gummy, chewy candy I would say is one of the worst. Why? Because it gets stuck into the teeth. So it just sits there. So all that sugar you have, you want to just lower the time it's on your teeth. So when it's just sitting there and it's all stuck in all your grooves and your crannies in your teeth and it's just there, it just has perfect timing for it to just seep in. And what happens is the sugar from the bacteria that's in our mouth, it turns it into an acid. Acid weakens our teeth and makes holes in them. So if you didn't have the sugar, you'd be somewhat okay. The sugar is going to help form into an acid, and then it makes those holes. So you want to get the sugar out as fast as you can.
Okay.
Now, when you get to the sour candies, well, that's just a double doozy because now you have the acid already there. That's just going to help, not make it any better. And your sugar, and it's just sitting there. So like Sour Patch Kids, those sour straws, anything long and lean, covered in sugar, sticky, ooey gooey, and then with a little bit of that citric acid or anything they put on it to make it sour, boom. It's just, you have a disaster waiting for you if you don't brush after.
Okay.
So again, eat your candy, enjoy it. If you can, avoid those type or just minimize it. Don't eat the whole bag, okay?
Yeah.
All in one sitting at least. And then if you go down the ranks of candy, you can get to like, your candy bars, get down to your chocolates. I know kids, I don't know about your kids. I don't know many kids who like dark chocolate. Do kids like dark chocolate? Not really, right? Now, I think it's more the milk chocolate that's
My girl just likes chocolate.
Well, I do too. But I think I want to say I didn't have dark chocolate until I was older.
Yeah.
Right? It's not your go-to.
No, you know what? You don't see dark chocolate as advertised with other chocolate.
It's not. I mean, that's not gonna be like, Mom,
it usually is on the other side or like separate compared to,
or they make it look like it's more luxurious.
Yes.
Yeah, like it's fancy.
Yeah.
Okay, so the good thing about the dark chocolate compared to the milk chocolate is, again, has less milk, or have no milk, and it has less sugar the way it's made. So, I mean, it's still sugary. It's still there. It's just not as bad. Yes. So, I would say on the spectrum, the highest would be sticky, gummy, sour, sugar-covered candy.
Okay, so that's like Twizzlers, gummy bears, like with this just the sticky part.
And even that, I would put that below like the Sour Patch Kids because, or those gummy worms, anything like has like that sour part onto it. I would say those would be worse. And then and then below that would be your gummy bears, your Twizzlers, and then get to your chocolate candy.
Yeah, like Snickers.
And see, and again, it's got that caramel stuff in it. It's kind of sticky. I feel like I'm really breaking this down. But, the bottom line is enjoy it. Minimize your one sitting, and then go brush your teeth.
So Halloween night, what everyone's dumping out their candy. What should our kids eat? How many would you recommend?
I would say, and again, I know I sound like the bad guy here, but what it does is it makes it easier for the parents. So parents, this is for you. Caregivers, this is for you. You can say, the dentist said you can only have your 3 favorite ones. Pick them out. Take out your 3. Enjoy them. Have fun. Eat them. And then put the rest away for another time.
Okay.
You want to limit your sitting because you don't want to eat candy all day long, all night long. You don't want to just be chewing, going. We all want to. Trust me. We're probably gonna. Okay. But at the end of it, you don't, because again, it's not even so much the amount of sugar, it's the length that is exposed to your teeth. Okay. So if you start eating at 5 and you keep eating until 9, just sugar. Again, you're giving it time to break down and turn into that acid, and make holes in our teeth. And that's what we don't want to do.
And just to break that down even more, it's like, say your Halloween party, right? Okay. So whether it's on Halloween or during the month, 5 p.m. you go to the party and you're having candy, but also other sour stuff as well. That just means just the same thing too. It doesn't have to be just candy,
right? Absolutely. Yeah. And what I would also recommend, that if you're going to be eating during the day that, go and rinse your mouth out. I know you're not going to have a toothbrush with you. Who carries a toothbrush with them? I'm not going to expect you to do that. But if you go and you get a glass of some water, just go to the bathroom, put some water in your mouth, swish it around. If you're at school and you go to the water fountain, get some water, swish it around. You remove some of those particles of the candy. Get some of that sugar out of your mouth and spit it out, because you're at least trying to minimize it, trying to get it washed out. So it kind of helps you out a little bit.
That's a great tip right there.
So if you don't have a toothbrush, do that.
Yeah.
Kids, if you're at school and or even if you're just having a soda at lunchtime, go rinse your mouth out, put water in your mouth, swish it around, spit it out. If your friends are like, hey, what are you doing? Like, you too, man. You rinse your mouth out too. You got to do it. So, spread the word, because it's just going to help you out in the long run. I promise you. You get into these little habits.
Yes.
It's really going to help at the end.
I love that. Like, so you just put something in my mind, like whenever my girl starts going to school and like when she gets older, is doing that. Like, at lunch when you're done, go wash your hands, but also go rinse your mouth out. That'd be a great way to start.
I mean, you could be that mom.
That preventive.
A toothbrush and toothpaste in her backpack. You can. We can start a movement here. That would be fantastic.
That would be awesome.
But again, too, baby steps.
Yeah,
right?
Of course. Oh, I love that. Awesome. So now we know you've given some great tips for Halloween month, but also like just for every day afterwards. Let's take it to the teeth.
All right.
Let's give our viewers a proper demonstration of how to brush our teeth.
Okay. All right. All right. Can y'all see this? So this is where there's so many different ways to brush your teeth, right? And the end result is you contact every tooth.
Okay.
And you contact all surfaces of the tooth.
Mm-hmm.
As long as you're doing that, you're okay.
Mm-hmm.
I'm going to start off right now just with my little tips in the sense that I don't want people scrubbing their teeth. You don't have to scrub hard to get them clean. I need that to be emphasized, because what happens is if you start brushing so far in, for example, you're brushing, we want you to go in circles. And we'll go into the technique here in a little bit. But what I really want people to know is that when you start brushing and you go in circles, the circles is for a couple of reasons. Number one is you want to get to the tooth and the gum line. Can we see right there? Right where the gum and the tooth touch? There's where a lot of our plaque lives. So, and plaque is that film that just gets in our teeth. Looks like masa. For those who know, it looks like that. So it sits right there. So what we want to do is we want to go in circles to help remove it. And this edge of our gum is kind of flimsy, or it's kind of like flappy and open. So you can get a little underneath it and kind of clean it. So it's a good way to go in circles. And it's more gentle on our gums. Our tissues, they're delicate. If you come in hard with this toothbrush, you go and you start scrubbing, these gums get scared of you. They run up. Right? So these run up, these run down. So then you get exposure to your root. So your gums pull up like, I'm not messing with this lady. She's brushing too hard. So it shows your root. And when you drink something cold, air, sweet, it's like, oh, it's sensitive. Why does that hurt? Well, you're probably brushing hard. And it tends to happen on our dominant side. So we're brushing our teeth with our hand that's heavy. So that's why we want you to go in circles all the way around where the tissues are, right? Where the gums are. You go in circles. And we want you to touch all of it, but definitely the gum line, because there's where a lot of that food or that plaque sits. Okay. So you go in circles. So if you get your toothbrush, you put it in your mouth. You can start on one side, whatever side you want, and you go in circles. And I like to start way in the back so you don't forget those teeth. And you go as far back and you go in little tiny circles all the way. And you kind of move it forward and you take your time. This is not a rush. But doing this, because you only got 5 seconds before you got to go to work, no. You're really going to upset your gums. So go in circles, go in time, all the way around. Okay. So when we open our mouth, see these grooves right in here? These grooves, there's where we get the little sticky stuff stuck in there. There's where we get a lot of the stuff that, can sit there. So those are the ones that you can scrub. Like those you can scrub.
Okay.
All right. You can get in there and scrub. Don't go crazy, but you can put a little bit more emphasis on these areas, because you got to get like the Oreos out or whatever it is that you were munch on, cereal, whatever it is. So those you can go. But again, don't forget that you still have to brush behind where the gum is and back in here. So make sure that when you do that, especially at the bottom, you do the inside all in here. And here you can flip out, because it's just easier to flip out. So when you have your toothbrush, you flip it out. And you're going to dirty your bathroom mirror. Everything's going to get all white on there. So make sure you clean your mirror when you're done. All right. But it's worth it. You need to make sure you get everything clean. Now, I will tell you, on people, especially adults or young adults and older, right in here at the bottom of our, right here in the very front, our bottom teeth, where our tongue is, right there, we build something up called calculus or tartar. So because our salivary glands are there, so it helps mineralize it. So whatever food or plaque stays there, it's gonna lock on, kind of like barnacle on a ship. Like it just locks on. So how you prevent that is make sure it stays clean here. So don't forget to do this side.
And that's why it comes like a little bump can be like formed right there or on the tooth.
On the teeth, like a chalky, thick, and that doesn't come off with your toothbrush. That has to be removed by a hygienist or dentist. So make sure you do that. So how do we avoid that? We just keep it clean, right? To minimize it, I should say. So anyway, so you go in circles. So I like using all of this. You go in circles, and again, in the back, in the front, light, gentle circles. And again, we don't want to brush too hard because not that it only abrades, but when you have toothpaste, some of our toothpaste can be abrasive too. It's kind of like Ajax, like they've got little particles in it to help like whiten our teeth or keep it clean. So if you're putting that on here and you're brushing it like you're scrubbing the tires on your truck, you're going to be in trouble. Like it's going to be sensitive. It's going to hurt. And your teeth are not going to be any clear. I know a lot of guilty people out there who do this. Okay. I'm not going to name names today. Because, you know, we're
going to call myself out right there.
So again, we just there's no need.
Yeah.
There's no need. When we get that plaque on our teeth, I know it sounds kind of gross, but you can scrape it. Like if you were to scrape it with your fingernail, you would see the plaque on your finger. So it's very light. It comes off very easily. So there's never a need to scrub your teeth that hard. There just isn't. And then if we're talking about the build-up tartar, that calculus, like that heavy blocked on stuff, it's not going to come off with your toothbrush anyway. You're going to have to get it removed. So either way, there's no reason to have to brush so crazy. Okay. So, and then when you're done, remember your tongue is right here. Brush your tongue. Tongue is everything. Brush that out. Get everything out of there, especially after drinking coffee or something that's heavy. You're doing everybody a favor by brushing your tongue. So do that.
Wow. Okay. Man, you know, I
know it's a lot, but I'm happy to go through it again later if you want to.
Yeah, I'm gonna have to. If only we can like somehow bring in a small child, and we can have them learn, because I know kids like they just like. Of course, we want kids to at least learn how to brush their teeth by themselves. But I know my girl, she does that. And now just seeing this, like, oh, okay, now I'm going to really have to teach her to like do it in circles.
And I think that's great. I think it's great that you let her do it. So, caregivers out there, brush the child's teeth, the children's teeth. Brush them yourself so you know that they're clean.
Yeah.
And then give them a toothbrush if they want to. Or just say, hey, look, let me do it. Let me fix it, and then you do it.
Yeah.
And then they like to play with it. Most of the kids will just suck off the toothpaste.
Yeah.
So, again, that's why we use very little, because we don't want them to, make it a snack. So, but yeah, I think that's a great thing. If you can do the majority of the work, let them kind of do it, get used to it. And
gotcha. Yes, man, this is a great tool. This is super cool. Can like anyone get these like from anywhere?
Yeah.
Oh,
I got that on Amazon.
Oh,
yeah, like my own personal stash, right? I mean, not that I walk around with a bunch of this all the time, but you never know when you're gonna need it.
No, exactly. I think I'm gonna need one for our home, just so.
And there's a lot of tools out there. There's like little clocks that you could do to time it, lights, and there's little songs you can sing. Like there's so many things, so many resources that you could find and that are inexpensive, easy things to incorporate. YouTube has a lot of videos on how to demonstrate, like cartoons.
Yeah.
I mean, there's so much information. Back to what we're talking about, like there's a wealth of information out there. So
agreed.
There's no reason, I think, at this point to like not know. You know what I mean?
Yes.
Because there's so much out there.
Of course.
And we're here. We're here to help guide and just kind of push you where you need to go. Not push, but gently place you,
maneuver your way.
Because that's the Driscoll way. You gotta be gentle. So we want to put you where you need to go. So
gotcha. And soft bristles,
bristles all the way through. Okay, so I'm talking to my adults out there. Soft bristles, please. I know they sell firm. I know they sell medium. I don't know why. Those are like what you use on your grill when you're cleaning your grill before you barbecue. Like that's what they're like. Again, our tissues are soft. Our teeth are soft. If you keep brushing, you're going to abrade or wear down your teeth. They're going to get the sensitivity. Some people have to have fillings put in to replace the parts they've worn off. Yes. So it's painful. Again, just to be able to drink water. Yeah. It's going to sting. I had this one patient where she couldn't bite into bread, like white bread, soft bread.
Oh no!
Because she would suck on lemon, like she would just put the lemon in her mouth and just suck on them all day long. She loved lemons. She sucked on them. Her teeth were divoted out. They were just like marked out, and we had to fill them all in because she just opening her mouth to talk, the air would touch and it hurt her. She couldn't bite into. She's like, white bread touches like hurts my teeth.
Oh my goodness!
I know we should have maybe talked about that.
No, I was like, which on
the sour stuff, the lemons, the limes. Yeah. Our culture down here, we love that stuff, which is so great. But again, and if I can say too, we're kind of going off here, but If you're going to have your lemon, you're going to have your Sour Patch, you're going to do all that. You got to wait. We're going to talk about that. You want to wait to brush your teeth because if you eat that and then go and scrub, you're just kind of polishing that stuff into your teeth.
Okay. So wait.
So wait
30 minutes. Okay.
And rinse your mouth.
Okay. So can you rinse your mouth like before the 30 minutes
or just during suck on lemon. Don't suck on lemons, but if you're gonna do that, go put water in your mouth, swish it around.
Oh my goodness.
Let everything kind of neutralize because your saliva needs to catch up. Yeah. That's the thing. Your saliva is going to neutralize the acids in your mouth. It's going to help break down anything else that's in there. So let your body catch up. Like you're overloading it with like all this sugar or all this acid. Goodness, You're just like a tidal wave, right? Like you open your mouth and this huge wave of just stuff comes in and your body's like, So you kind of have to give it time to just like make more kind of produce, and then like, okay, get it under control.
So 30 minutes minimum to brush your teeth.
I think that's a fair amount. Yeah.
Okay. So what's like the latest, like before that's like too long?
I would say in a day before going to bed.
Okay.
If you think about how many times you eat in a day, at least me. All right. I'm going to say minimum 7, maybe. The snack and the snack. And then there's like pre-breakfast, breakfast, and after breakfast. All right. So you have all this food that you're eating. So you think about how many times you introduce food to your mouth, right? To your body. And you brush maybe once, twice a day. So it's all there. And that's because we haven't even talked about the flossing. Yeah. So flossing is all of it. So that's why I think it's very important that, again, the flossing is because we can't get between the teeth. How do we get the toothbrush inside the teeth? We can't do that. And we want to get in there. So we'll talk about that.
Yes. On our PSAs. Yes, we'll have those videos for y'all. So. Well, that's awesome. That's really great to know. And it's funny because you were talking and now that we're about to go into like our spooky dental stories, the faces I feel like I'm making is like whenever you talk about teeth, like, ow. Like, I was like, I can you imagine just thinking about it. Okay. So you mentioned the lady who can't bite into bread.
Yes.
What other kind of like spooky dental stories that you've seen or you've heard of from your point of view?
I'm thinking spooky. There's crazy
or like strange or crazy.
Okay, I will say this. I've had a lady ask me to pull a tooth with no anesthesia. Yes, and I remember that very specifically because she had cracked a tooth and it was kind of split in different pieces. One of the pieces, like I said, was kind of superficial. It's kind of on her gum line. Okay. So it's just kind of stuck to her gum a little bit.
Okay, so it's like...
So that part of that tooth, okay, I'm sure it would have been uncomfortable, but we could have taken that out with nothing. The other two were embedded into like her socket, into the bone. So she needed it out. She was adamant. She was so afraid of the shot, the anesthesia, so much so. Yeah. She's like, I'd rather just have the tooth pulled without it. I'm like, but this is going to make it feel so much better.
And it's two teeth?
It was a tooth that was split. It was
okay,
gotcha. She had cracked it, but it was a big molar. And so she was just adamant that she wanted this pulled with nothing. And I tried to convince her, and I did everything I could. Couldn't convince her. So I was like, okay, you're down? Yeah. All right, well, let's see what you're made of. Let's do this.
Oh my gosh.
And I did it.
And I did it.
I lived to tell. It happened. But she was a trooper.
Okay, yeah.
She kept saying, I've given birth. It can't be that bad. That was like her mantra.
Yeah.
And she kept saying that. And she's she's right, I guess.
Yeah.
But again, we were gentle.
Yeah.
And tried to be as fast as we could and get it done. And she was grateful. She was very grateful. She was happy. She was grateful. Okay. I was sweating. Yeah. I mean, it was like the worst thing.
Did you like feel the pain more than she did?
I always feel the pain. I will say this. I always feel the pain. That's what makes my job sometimes stressful because I know the anxiety they're coming in with. I feel these kids when they look scared and they look at you with their eyes.
Also, you like absorb it.
Oh my gosh. Adults who have had a bad experience. Yeah. I mean, I don't know how many times we've cried in the chair with patients. We've held hands. I mean, I've had some ask me to pray with them. Like it's such a great feeling to know that you can help someone, make them feel safe, feel confident, have them feel in control of their treatment. Yeah. It's such a thing because I want to work with them, not on them. Yeah. That makes sense, So I just, so this is why I guess I come in here and I get excited to talk about this stuff, but I really want it to be absorbed and I really want it to be taken seriously because like, we care about you. You know, we want you to be at your best self. You know, we don't want you to have to go to the dentist and it costs money all the time and get drilled all the time. I hate that stuff.
Yeah.
And this is what I do for a living, right?
Yeah.
But I want it to be known that it doesn't always have to be like that. Let's just take care of it on the backside so then we can enjoy our dental
Exactly.
life.
Oh man. Did she like how does she
her husband was freaking out. Like,
okay, I was like, I don't know how to go with this. Like
he was panicky.
Yeah. He was in the room.
He was in the room. He was holding her hand, but she was a soldier.
Yeah.
She soldiered up.
There you go.
I would never do it again. Because I think I was more the hindrance. Like,
yeah,
wow, this feels awful.
Yeah.
This doesn't feel right.
Yeah.
But no, it got done. And
I know, I bet. Like, I was like, how?
But she was good. And if it was just gangling there, I'd probably been like, okay, no problem. But
yeah,
it was in there. It was.
You were leaving me speechless right now. I'm like, man,
yeah.
What a trooper.
Yeah, she came with a mission. She wanted it done.
Okay, done. She did it.
I needed a break after that. I was like
nice.
Sweaty, and I was like, never again. If you're out there listening, I will not do this again.
I remember my first visit. I mean, okay, so like tracking back just a bit, how I grew up with like my mom's like, oh, you know, dental's a luxury. So I think my first visit wasn't until I was probably like 12, 13. Okay. Good thing, you know, I didn't have any like major, like I didn't need braces. I didn't have any like cavities that I remember. But I remember my first visit and they were doing, it was to take my wisdom teeth out. And I had no idea what was going to happen. I just remember going in, I guess, like for the first visit and then them seeing that it needs to be taken out, leaving, coming back for the actual procedure. Or I don't know if it happened the same day. I'm not too sure. But I just remember them doing something and like just seeing like my mouth, like basically like I squirted out at them. I'm like, I so that, if anything, that was for me, that was like traumatizing because I felt like, I don't know, it's like weird, like a nerve back there or something, and just water just comes out. And it was just, I don't know. And I was like, man, that's so embarrassing. I don't want that to happen every time I go to the dentist. Like,
well, you know, it's funny because going home every day, you're going to go, I don't want to say covered in saliva, but yeah, I mean, and it gets aerosolized, like when you use drugs, it gets blended in. And then I don't know how many patients you see in a day. You can see, I mean, I don't know. Let's say even if you see 10,
yeah,
and you're doing 10 procedures. I mean, that's 10 different people's saliva flying up in the air. I mean, you're right there in front of them, and you know, so it can get in you. I remember one time I was doing this one extraction, and I was looking for one of the little roots, and a little piece of the root broken off. We're digging it out, trying to look for it, and I couldn't find it. I knew the patient hadn't swallowed it or aspirated it, so that's all you really care about those moments. And you're doing it, and I went home, and I'm taking a shower, and I'm shampooing my hair. I'm like, wait, what? And I'm like, oh, there's that piece. So it was in my hair. I've had roots fall on my shoe. You know, with the blood go on the shoe. Like and spitting in the face. People when their mouth is wide open and they start to cough or burp. Yes, I said burp.
Dentists are very special people. They really care about you.
I'm just gonna say that right now. Like this is a labor of love.
Care about us.
It's something I know.
Oh my goodness. And that's a spooky story just within itself. Like I can't even imagine. That's crazy. So just being like hypersensitive to like bread from eating like acidic foods to going without any type of medication for surgeries. That's awesome. Is there anything else you remember?
Now, you know, I will say, I think with a kid, I mean, you have some kids, like you were saying, you have some kids who just sit there and just take it. I had this 3-year-old who just let me do like anything and everything. It was so great. And then I have like a 46-year-old man who's like crying for his mom, you know, so I know so it's such a range of people, you know, you don't know. It's just a personality. It's what they're able to do. But I think the underlying thing is you got to feel comfortable. I can't push that enough. Find yourself a provider where you feel comfortable for yourself, for your kids. If you can make the same dentist for the family, you know, that would be great. I know some kids need the pediatric dentist. Some of them will just go to family dentist. Find yourself a dental home, and maybe as your kids age out, you know, and they need to go to a adult dentist. You know, that might be something that you might want to do to just kind of keep it all together. You know, so then everyone can be seen.
Gotcha. So spooky stories don't have to be spooky visits, y'all.
People are already scared of the dentist. We're spooky, I guess. We're kind of scary, but we do it with love. Okay, so don't let that keep you.
No, for real. Like the fact that like how gentle y'all are just from like 6 months old, like toddler range, like I'm sure I can positively say that they are just as gentle with 90-year-old, 80, 70.
Oh, for sure. Well, and again, I think it's your personality too. Like, I will say there's a lot of pediatric dentists out there that are just amazing. I'm telling you, you want to talk about doing God's work? Those people do it. I mean, they take care of the babies and the children, and they're very good and very gentle. There's a lot of general dentists, such as myself, who works on all ages, and we do what we can, but the miracle workers are going to be the specialists for sure, because they do great things as well. So, I'm very happy to be part of a community here in Corpus, and because I used to work in the Valley, we still have connections there. That there's a lot of great providers out there.
Nice.
So I'm very glad to be part of a region of Texas where we got some really great dentists.
Awesome.
Who are happy and ready to see all of our kids.
I love it. I love this episode because not only do we dig into Halloween, you know, this is how we should approach this month, how long we should wait until after taking in all this sugary goodness, brushing our teeth, how to brush our teeth, and then tips, and then just also just giving real insight of how a dentist like you sees patients and how your mind thinks and everything like that. So yes, I really appreciate you coming to the pod and coming dressed up because we have to just fit the theme.
Of course.
If you like this episode, like and subscribe to our channel. We also do have multiple dental videos already on our YouTube channel, so go and check those out. They're a couple minutes long. Just take some time, sit down with your children, sit down with your family, and learn some of those tips as well. We also do have some PSAs from Dr. Carmen Martinez herself on our social media. Check those out. No longer than a minute, no longer than 45 seconds. Those are great. We can never get enough dental health here. Dental awareness.
I love that. Like I'm telling you, it all goes hand in hand.
Yes, it really does. And once we connect that full circle, we're living a great life here.
Oh, yeah.
So thank y'all for joining in, and I hope y'all have a great rest of the day. Bye.